Tonight, one of Colorado's largest hospitals facing a crisis. Physicians at Denver Health telling us they treat everyone who comes to the ER regardless of immigration status or ability to pay. But they're struggling to handle a spike in migrant patients.
It's been really, really hard to take care of them, both in terms of their inability to pay, but also just the sheer volume of patients that we weren't expecting.
Denver has a population of 700,000 people. And just the last year, nearly 40,000 migrants have arrived. The mayor declaring a state of emergency. More than 8,000 migrants have come to Denver Health for care, and most of that is coming out of the hospital's pocket. The hospital says they need more help from federal and state government to pay for over $10 million in unpaid migrant medical bills so far. Outside a shelter, we meet Mary Anise and her 3 sons. She's being treated here for Parkinson's. I'm very grateful. In my country, it was very difficult. We were not able to get medicine for my condition, she said. Emergency room pediatrician Dr. Christy Rodriguez says they want to give patients the care they need, but they need funding, with the hospital facing a breaking point. Is this an emergency here?
I think it's about to be. I think this isn't sustainable how it is right now.
Meanwhile, Denver's public schools are also scrambling to keep up, with nearly 3,000 new migrant students.
So we've had around 100, which makes about 20% now of our student body. Now, over time,
Principal Brian Clark's school now receives 5 to 10 new students per week, what they used to get in an entire year. Now, some classes have hit the 35 student limit, so some students have had to be transferred to other schools. Come February 5th, the city says they'll start restricting stays on migrants in shelters and kicking many of them out onto the streets. Some migrants we spoke to said they don't know where they'll go. Lester?
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.